Traditionally, we think as police officers, those responding to law enforcement needs within the community. But honestly, we are there to serve our citizens, and our citizens do go into crisis. They do have mental health crises, and we're being called to those scenes on a regular basis. In order to help serve those citizens better, we did initiate the Crisis Intervention Team Program. These are officers that are specially trained to de-escalate crisis situations. Recently, we've brought co-responders onto the scene, licensed qualified mental health professionals housed within our police department, and they respond with those officers directly to those scenes where a crisis is occurring so they can interact with that citizen and get them the help they need right there on that scene.
The co-responders are either a bachelor or master level in a behavioral health related field. They wear plain clothes, they don't carry weapons or anything like that.
I have a police radio that I listen to all day. Listen for, those key words: mental health, behavioral health, crisis.
There's a lot of officers that just call for me. I have my own radio number.
I also have the ability to self-dispatch to them and say 982 is en route.
Officers en route, 914, Armstrong.
So typically I arrive after they've made it safe. I'll make contact and get kind of the rundown, and then I just kind of jump right in.
Like, hey, my name's Allison. I'm a mental health professional. I'm here to help you. I'm not here to take you to jail or arrest you.
Sometimes all a person needs is a voice, someone neutral, someone outside that, can listen. I do a lot of safety planning, including family, their support network, who's close to you. If they're home alone, who can come over and hang out with you today? Can we lock away your sharps? Can we put up your meds? Do you need meds? Can we get you over to the urgent care to get you assessed for your medications? Some of them also are like, oh, I'm so glad you came. This made me feel so much better.
Our main goal as co-responders is to, one, get people connected to the services that they need, and also divert from emergency rooms and jails.
And they almost get a different view of the police responding. That lets me know you care and the officers care.
Please, how can we help you?
My husband has...
In 2020, we had 722 mental health related calls for service. 2022, by that time, 1,479. These mental health related calls for service are increasing. How we're responding to that is increasing the number of crisis intervention team officers we have available, as well as the number of co-responders we have available to respond on these calls.
So what I think is important for the community to know about the co-responder program is that we're here, we exist. All you have to do when you call 911 is ask for us. Say, hey, I want a co-responder to respond to this crisis, and we'll go. I was really struggling about 8 years ago on my personal journey with mental health, and I met some amazing social workers and amazing programs that have helped me get to where I am today. I really couldn't see myself doing anything else. We want to help, and that's what we love to do.
So I had a client, we got a call, she had some suicidal ideations, and she really felt that she had nobody. And getting to know her story and getting to know who comes around and sees you, well, then we found a support person, and they responded immediately, and we made a plan. I called back and checked on her in an hour, and then I checked on her in 2 hours. We were able to get her into the additional services to where she talks to someone every week or more. I just took a person that really just thought they had nobody and nobody would show up for them, and show them you do. And you'll be amazed who is in your corner if you just simply say, I need a little help.